This ain't your Nana's joint replacement episode. Dr. Omiyi from the Sarah Bush Lincoln Bonutti Clinic stops by Being Well to break down the latest in hip and knee replacement, how joint physical therapy is changing, and what other options are emerging for patients.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
Thank you for joining us for this episode of Being Well. I'm your host, Lacey Spence, and today we've got joining a new guest to the show. We've got Dr. Omiyi from the Bonutti Clinic for Sarah Bush. Welcome to Being Well.
Thank you, Lacey. Glad to be here.
Of course. So we love to get to know our new guests of the show. Can you give us a little bit of a background about who you are?
Yeah, absolutely. My name's Didi Omiyi. I'm an orthopedic surgeon who's been in practice with the Bonutti Clinic in Effingham for about 8 years now. I'm originally from Nigeria, but I've lived here in the United States about 24 years, doing all my training in medical school. I did medical school in Chicago, Northwestern University. My residency was at Howard University Hospital in DC, and then I spent a year in New York doing an additional year of training in what we call adult reconstruction, which is basically focused on total hip and total knee replacements, and then back to Illinois in practice.
Wonderful. Of all the places you've been, do you have a favorite?
I love Illinois. I've just, I think combined with Chicago and been here, I've lived here now probably about 12 years in the Midwest. Love the people, weather's mild, and this has definitely been my favorite part. That's why I'm still here.
There's a lot of variety within the state. People don't exactly realize that. We've got metropolitan, rural, a whole gamut.
Exactly. We've got everything, which is great.
Awesome. Well, today we are talking about hip and knee replacements. So first, let's dive into what is rapid physical therapy.
So rapid physical therapy is almost like a catchphrase that we've been using to describe the rapid mobilization of patients after a joint replacement surgery. So 15, 20 years ago when we started, when we're doing hip and knee replacements, patients would stay in the hospital 4 or 5 days. We'd get them up carefully and slowly. But we realized that patients do a lot better if we get them up moving quicker. And so nowadays we do joint replacement surgeries and we have patients up within hours of the surgery. We have them walking down the hallway with a walker. We have them practicing stairs the day of surgery. I mean, our surgeries have come such a long way. The patients are really being able to mobilize quicker. And as a result, they get started in their physical therapy regimen within, hours. They're seeing their outpatient physical therapist within a day or two. And this just allows them to get back to their regular lives quicker and recover quicker from the procedures.
Which I'm sure is music to the ears of a potential patient, is to get going again.
Absolutely. Patients usually worry about what their downtime is going to be, how much time they're going to need to take off work, how much time are they going to be able to take away from taking care of either their kids or an elderly parent. So knowing that they can be moving right away and recovering quicker really allows patients to take the time to take care of themselves with these procedures.
So let's take a step back a little bit. For patients who are experiencing issues with their joints, do you typically see older patients, younger patients, both?
We really see both.
Okay.
There's so many different factors that contribute to patients having joint pain. whether it's trauma related, whether it's age related, whether it's just activity related and things like that. So we'll do joint replacement surgeries in patients as young as 39 and as old as 99 sometimes. So we definitely treat a whole gamut or a wide range of patients.
And so as we're talking about this rapid physical therapy, is everyone a good candidate, or what makes someone a good candidate for this?
We evaluate patients before surgery to see who'd be a good candidate for it. I'll say the vast majority of our patients are good candidates for rapid physical therapy. Again, the outcome of the surgery, it's directly tied into their physical therapy afterwards. And, I tell my patients, 50% is what I do in the surgery and 50% is what they do working with their physical therapists. And so we evaluate patients before surgery. We actually have a program what we call pre-rehabilitation, where patients spend 4 weeks before the surgery in preparation for therapy, trying to improve their motion, improve their strength. And once they're optimized for the procedure, then we know how quickly they'll be able to participate right away. But pretty much all patients can be candidates as long as they're medically able to tolerate the procedure. They're usually medically clear to participate in therapy right away.
Wow, I didn't realize that you could, or you were, I guess, engaging in preparation before the surgery, like that physical therapy.
Oh yeah, no, absolutely.
Is that new?
Absolutely. I think literature over the past 5-10 years has shown that patients who are more optimized, so they have better range of motion, they have better strength, they have better condition and endurance, all recover faster from the procedure. So we've really focused on trying to prepare patients for the surgery, especially since we're not keeping them in the hospital as long as we did. Some patients are only in the hospital for a few hours after they get a joint replacement. So because of that, we're really spending a lot of time before the procedure, getting them ready for it. And physical therapy is one of those things.
And this is my question now. It's a little bit sideways from surgery and things, but is it good to incorporate working on the flexibility and things of that nature, even if you're not needing surgery, just to prevent it?
Oh yeah, absolutely. So the better conditioned a joint is, a knee or a hip, the less symptomatic they'll be from a degenerative condition such as arthritis, for example. So if a patient who has an arthritic hip or arthritic knee has better motion, better strength about their joint, and in better shape, they actually will have less pain from that condition than someone who doesn't have that same motion or that same flexibility or strength in the joint. So one of our mainstays for non-surgical management is physical therapy to see if patients can avoid a procedure. And so absolutely that makes a difference.
So then as we're going back to talking about the same day discharge, what makes someone a good candidate for that?
Once again, our techniques have really improved to the point that most of our patients are candidates for discharge home the same day, as long as, medically they don't have any conditions that would prohibit them from staying, an extensive heart history or some cardiac issues that we need to monitor overnight. One of the big things that will keep patients in the hospital. But in our protocol and our program, any patient who's under 75 and is otherwise in reasonable health and has a support system at home to take care of them after the procedure, they're candidates for same-day discharge. And we find that we send almost 90-something% of our patients who fit that category home the same day.
Wow, that's a pretty big number.
It really is, and it's interesting because it's across the country, same-day discharge from joint replacements has become, not quite the standard of care, but pretty close to it. In fact, CMS and Medicare and Medicaid now consider hip and knee replacements as outpatient procedures, meaning that, patients either go home the same day or a 23-hour stay in the hospital. And that's just really reflective of what we've been doing in practice, over the past 5 years or so. And it's great for patients, again, because they realize that, they can really get up, they can get up and moving, they can get back to their lives and get back to their families and spend their recovery time at home instead of being in the hospital for long periods of time.
Yeah, and let's circle back. So having that family support system, what does that look like? Do you also take into consideration someone's living situation, whether they've got like stairs or things of that nature?
Absolutely, yeah. So we at the hospital, at the Bonutti Clinic and the Sarah Bush Lincoln Hospital, we have a caseworker who specifically calls patients before the procedure and asks all those questions. You know, how many stairs do you have? Who's going to be with you? How, you know, what's the size of the doorway to your bathroom? You know, can a walker get in there and things like that? So a lot of little things that we ask all these interviews to find out, okay, are they going to be safe when they go home and be able to be discharged home the same day? And so, and if patients don't have those things in place, or they're things that patients haven't thought of, having those conversations beforehand allows them to kind of prepare. Some patients will say, you know what, I realize that my home is not going to be the best place for me to recover. I'm going to stay at a daughter, I'm going to stay at a sibling's house for the first few weeks to kind of recover. So we take all of those things into consideration as part of our joint program.
Or like if I have a large wily dog, maybe they can stay at the sister's house or brother's house just till we've recovered.
Maybe not a bad idea to have someone babysit that pet for the first few weeks, absolutely.
Gotcha. Well, as we're talking about surgery and things, what about minimally invasive surgery? So are these outpatient surgeries minimally invasive, or are they two different things?
No, so they're all pretty much the same thing in the sense that minimally invasive procedures allow us to do these procedures through smaller incisions, less dissection and trauma to the tissue, which directly leads to a quicker healing time, less pain after the procedure, which allows patients to recover quicker. And because of these techniques, that's what has allowed us to be able, one of the reasons we're able to send patients home same day or quicker is by approaching these surgeries with, again, more minimally invasive techniques.
And let's move on as well to robotic surgery. Let's talk about that a little bit.
So yeah, so robotic surgery is definitely something that we're excited about. You know, we're seeing more and more the role of a robotic assistant in joint replacement surgeries, both hip and knee replacements. We have multiple companies that provide these implants for us that we use to replace joints. And almost all of them have some sort of robotic assistance now as part of the package. What this allows us to do is it allows us to get more detailed information about a patient's joint. So getting a CT scan or a specialized x-ray in addition to our routine x-rays. It allows us to then personalize their procedure before we even go into the operating room. So we can digitally plan what size of implant we're going to use. We can digitally plan what kind of cuts we're going to make that's going to be unique to each patient's anatomy, which is different. And then we use a robotic arm or tool of different varieties of that in surgery to help us to accurately execute that plan. So prior to the use of robotics, we had different jigs and guides that we would pin onto the bone and do a lot of our measurements with that manually, and we had great results with that. But we found that with those instrumentations, we were making patients kind of fit a little bit more what those instruments had us measure, as opposed to now with robotic assistant and some of the more detailed information we can get from a specialized x-ray or CT scan, we can now match a procedure more specific to the patient's anatomy. That then leads to less dissection, it leads to less altering of their biomechanics. And patients feel more comfortable after surgery, they have less pain, they recover quicker, and they feel that the joint replacement they have, it's not exactly what they had before, but it feels a lot closer because we can personalize the procedure. So I always tell my patients, you know, we're in control of a robot throughout the procedure and joint replacement. So it's not that they have a robot independently operating on them. But
the future is here.
Exactly. We might get there at some point in time. But it's an incredibly useful tool to allow us to do things, you know, to a millimeter or to half a degree of accuracy when taking care of patients.
And I'm sure it has to feel good for you to be able to offer such personalized care so that you can send these patients on their way knowing how much better off they are.
Absolutely. Yeah, you know, again, you know, we're seeing patients having less pain, quicker recoveries, and again, we feel that, you know, we're offering a personalized surgery, and again, it just continue to build on the improvements in this field with that.
And we've talked a lot about how long it takes to, you know, spring these folks from the hospital, but how long typically do these procedures take?
So, most routine joint replacements will take maybe about an hour to an hour and a half or so of our operating time, is what I tell patients. Now, they may be in the operating room suite for 2 hours, 3 hours, depending on being put in position, anesthesia, the recovery time, and things like that. But the surgeries themselves are usually about an hour to an hour and a half of actual operating time, as long as it's a routine case.
And you mentioned anesthesia. So for these, you're typically getting put under completely?
Yes. Most of these surgeries are either done with general anesthesia when patients are out completely, or with regional anesthetic techniques, or what we call a spinal anesthetic, where basically patients receive an injection in their back and they're pretty much numb all the way down, and they receive some sedating medication through the IV. And, they're, again, not aware of what's going on, and we're able to do procedures that way.
So post-surgery, we're assessing how things went, and maybe I'm left with some pain still. Are there good ways to manage that, or is there a couple causes of what might still be causing me pain?
Yeah, no, absolutely. So part of, doing a joint replacement surgery is helping patients to understand that these are still very big procedures. And even though we get patients home the same day and we get them in rapid therapy and they're moving, there is still going to be some discomfort as part of the healing process. So a lot of it is just educating patients on what's expected. Patients may need stronger pain medications for the first 2 or 4 weeks of the procedure, which is not unusual at all. And I tell patients to expect that. And what we like to see is the pain is continually to improve every week or 2 weeks or so. If we have patients who, we get to a point where we think that their pain should have fairly resolved and they're still having some problems, then we always have to make sure that there isn't something going wrong or there hasn't been a complication with that. And, we pay special attention in those particular cases. 95% of the time we don't run into those issues, but of course with every surgical procedure there can be risk, and there are some things that can happen that may need to get readdressed. But we pay special attention when we have patients in those categories to rule out anything, and hopefully there's nothing else that we have to do to get them back on track.
Mm-hmm. So you'll go back and take a second look. See what's going on.
Well, evaluating them in the office, yeah, absolutely. And then there are some cases, very rare, exactly that, where we have to take patients back to the operating room to take a second look to try and see what's something that needs to be addressed or treated. Again, with any surgical procedure, you worry about risks of infection, you worry about risks of the implant not fixing to the bone, or things like that need to be readdressed. And so sometimes we do unfortunately have to take patients back to deal with it, but that's part of what we're trained to do.
Right.
Especially as joint replacements become more and more popular. More and more patients are having artificial joints. These joints eventually may wear out, may need some parts changed, and we're hoping that's less and less with the new materials and new techniques. But there's still going to be a need for us to do revision surgeries, and that's part of what we're trained to do.
That's actually one of my next questions: is how long do these replacements typically last?
Yeah, no, great question. I think that there are a lot of studies out there which have shown that we've seen joint replacements lasting 35, 40 years in some patients. And when we look at that literature, that's with some of the materials that we were using 35, 40 years ago. And so with some of the advancements in the materials that we're using, and not wearing out as quickly as some of the materials we used in the past, we really think that if patients don't have complications after the procedure, then hopefully that they're only going to need one joint replacement in their lifetime. We see complications such as an infection or something loosening from the bone or something coming unstable, depending on what studies you read, anywhere from 3 to 5% of the time. So if we can avoid that, we think 95% of the time, hopefully patients will only need one surgery.
That'd be great.
Yeah.
So for someone who's maybe not as familiar with talking about joint replacement, me included, what did the material used to be compared to what we're working with now?
Oh, I think that conceptually the materials are the same. So,
okay.
But for example, when we replace a hip or replace a knee, we use metal parts to replace the bone in the joint. So the arthritic bone, we cut that out, and we use the metal parts to replace the bone that we take out. And that's exactly, the more durable, the harder parts. But there's also the cartilage that is also cut out, that's worn out, that we have to replace. And we use some sort of a polyethylene plastic. Now, we found that, the way we process that plastic can affect the durability of that. So as a result of that, our new processing techniques for those plastics have allowed them to wear out at a much slower rate, which then allows for more longevity of the joint. So that's an example of a material development that has allowed us to do these surgeries and have implants that are surviving longer.
Wonderful. So if I'm someone who's got knee, hip, joint pain, and do I start by trying to contact the Bonutti Clinic? Do I start with my primary? Where do I go?
You know, either option is fine. You know, a lot of patients will start with their primary physician, who a lot of times will start off with, you know, an x-ray to make sure that there's, you know, nothing worrisome going, and may start some treatments, whether with an anti-inflammatory medication or course of physical therapy. But, you know, we're very happy to see the patients right off the bat. Again, you know, we're able to you diagnose things quicker and be able to get that expert opinion to say, you know what, this is really something that doesn't need anything surgical. This is something that we can treat without surgery, whether it's a medication, whether it's physical therapy. We can give a sense of patients of where they are. So if we're dealing with somebody who's got an arthritic joint, we can say, well, you know what, you do have some arthritis, but this isn't a case that's ready for surgery yet. So, you know, these are things that you can work on with therapy, weight loss, medications, and things like that. And hopefully that should be ideal. Our approach is always to try and treat things non-operatively if we can, and reserve surgery really for when all other options have failed. So we love to get patients right at the start of the process or the issues, because that allows us to give them some education about things and really prepare them for what may be coming, or at least how to educate them on how to avoid, hopefully potentially avoid a surgery.
You don't want to make things worse, that's for sure.
Absolutely.
So if I'm somebody who's maybe had a replacement in the past and unfortunately it's not lasting the 20, 30 years, what's kind of my red flag that something's wrong and I need to reach out?
Definitely pain is always the first thing. All right. Usually when patients are starting to have pain, especially someone who's had a joint replacement that's been fine for, you know, the past few years, and all of a sudden they start developing more pain, instability. You know, these joint replacements are meant to be stable and secure and supportive. So if our patients start feeling that their joints are giving out, absolutely something to take a look at. Very rarely, but occasionally, joint replacements, when they start failing, stop making some funny sounds. And so if there's some new sounds being heard in this artificial joint and people can hear you coming down the hallway, then, you know, maybe that's something to have to take a look at. And so I always advise patients that, you know, we're here, our door's always open to see patients. So if they have any questions or concerns about it, they can always come see us. As a joint replacement surgeon, you know, even though we know these joint replacements are lasting longer, we really see our relationships with patients as a long-term relationship, which means that, you know, for the life of that joint replacement, we're always available to evaluate things. Typically, we'll see patients a year after surgery and then 5 years after surgery to take x-rays and see that things are surviving. So we really want to maintain those relationships and encourage patients to come see us with any questions they have.
Yeah, because you don't want it to be like, oh yeah, I just have this bum knee, and it just progressively gets worse when you could have caught something early.
Exactly, yeah, especially with joint replacements that who do have issues and are failing. A lot of times it's better to address them quicker so that the problem is easier to fix than waiting later on.
So as we're in our last couple of minutes here, what are maybe the biggest differences that you've noticed in your last several years of practicing?
Yeah, no, I think that, like we've talked about before, one of the biggest things is just getting patients out in the hospital. When I first started training, we were keeping patients with a joint replacement in the hospital routinely for about 3 days before they went home. They maybe wouldn't start therapy that day, and then the next day they maybe just sit up to the chair, walk to the doorway. So I think over the past 16 years since I started my training now, and 8 years since we practiced, again, we've talked about rapid physical therapy. We've talked about getting patients up and moving quicker. We realized that these patients after joint replacement surgery aren't quote unquote sick. These are usually patients who are healthy and optimized, and so we get them moving quicker. We've seen the role of technology coming in, robotic assistance, again, allowing us to do personalized procedures. We're seeing our techniques for controlling pain being a lot better. So we use nerve blocks, we use different sort of medications during the procedure. And patients wake up and are actually fairly comfortable for the first 24, 36 hours, which allows them to kind of start moving quicker. And we're seeing medications being used to help to reduce bleeding with surgery. So it wasn't unusual to give patients blood transfusions every once in a while when I first started. But nowadays, with most routine healthy patients, that's almost unheard of when the first time joint replacement having to give a blood transfusion, because our techniques for controlling blood loss have been so much better. So all these things and all these improvements are things we've been seeing, which makes the field exciting, because we know that we can get patients better quicker, and really allow them to get back to the things that they want to do, which led them to have the surgery in the first place.
And that peace of mind that you're going to get in and out is just huge.
It makes a difference. Patients recover at home. Everybody wants to recover better at home. Everybody wants to be at home in their own environment and they're comfortable. And I also say that I believe patients do better when they have to get up in their own home to walk to the fridge and walk to their bathroom, as opposed to being in a hospital bed and having everything right there before you. That is part of the therapy, just getting back to your normal routine.
Well, and you've got your shows at home and your
Exactly.
your support system, your family's
got your favorite
there.
recliner and all that kind of stuff.
And it lowers the stress.
Absolutely. And that mental part of thing also helps patients recover quicker too.
Very good information. Thank you so much for coming on our show today. We appreciate it.
Lacey, thanks so much for having me. It's a pleasure.
Of course. And we hope our viewers will join us for our next episode of Being Well.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.